Hey guys, so parents often ask like, how do I know if my child will need braces? So I'm gonna go over a couple signs that you can look for so that will give you a good idea if you should go see an orthodontist or not. The easiest one is, right, are their teeth all crowded, right? Are they here, there, and everywhere? Is a really simple sign. Another one is if they maybe lose some baby teeth early, or if they still haven't lost baby teeth and you feel like they should have. That definitely could be a sign that there's some underlying issues going on that might need to be evaluated to see. Another one is, if their teeth aren't coming together properly, right? If you notice in the front, like they don't come together, or even on the sides if it's open, things like that, would be a good sign that there might be a bite issue, or if they're having trouble chewing, should be evaluated as well. Now, another one is if you notice that they are a pretty heavy, like mouth breather, or if they have habits like thumb sucking, or if they snore at night, it might be good to come in and we can do a little airway evaluation and see if something's going on there that might be better to fix at an earlier age. I'll do a whole nother segment on airway and the necessity of getting the right amount of oxygen in, for your child as they develop at an early age. A sign that you can look for is if they have a severe overbite, on their front teeth, or if they have like an actual underbite. These are all things that sometimes we need to address very early on. Sometimes we can do a little bit later, but definitely good to get it checked out if you're seeing some of those severe things. Or even a severe deep bite, if their bottom teeth are almost hitting the roof of their mouth, something that may be worthwhile to get checked out. If they're having like jaw problems, like jaw clicking or popping, or if it's hurting or just kind of notice they shift it around a lot, there definitely could be some bite issues going on. Good news is that, when we do an evaluation at a young age, a lot of kids don't need braces or treatment at that age, but the evaluation is free and it's worthwhile to get that peace of mind to make sure that your child is growing and developing properly, and that's what we're screening for. So that's why we do recommend that they get checked out at age 7 or 8 years old, probably at the latest. Feel free to ask any questions, comments, and we'll help you along that journey to make sure your child is well taken care of and they get the smile that they deserve. All right. Please like, subscribe, and content if you like this information, and we'll try to keep providing good information for you.